Business Committee for granting this debate during National HIV Testing Week in England. Each year, the campaign funded by the Department for Health and Social Care and delivered by the Terence Higgins Trust as part of the National HIV Prevention Programme in England brings us together to raise awareness of HIV and promote regular HIV testing, particularly amongst groups most affected by HIV. I think it's always the way that this Parliament works, that this debate coincides with another debate on LGBT History Month, because the two subjects are so linked together. And over the Christmas recess, I was reading Alan Hollandhurst's book, Line of Beauty, and it does bring home the fact that at that time, in the 1980s, a test was potentially a death sentence, and people dreaded going for a test because they dreaded the result that it might bring and the impact on the life of themselves, their family, and those close to them. And that we've moved on to be able to say with 100% certainty that if you get a positive result from a test, an HIV test, that you can do in your own home, treatment means that you can have a normal life expectancy and can't pass it on. And that remarkable fact is what makes this a generation that can end new HIV cases across this country. And I encourage everyone in this room, across Parliament, watching these proceedings to take part in the campaign and order a free HIV test. And I was particularly pleased myself to see the Prime Minister take a test and demonstrate how straightforward that was, how lacking in process. I think many people still think that a test might involve needles and having to have health service professionals involved. You can take a test at home with an easy-to-access kit. Yes, I will say.
I thank the right member for giving way and his excellent opening remarks on this. Does he agree with me that with the Prime Minister taking that test in Downing Street, it recognises that and it attacks and it highlights the issues around stigma and the fact that you can test safely within the confines of your own home without any glare of anyone else in a clinic? You in that test kit, simple results.
Yes, I absolutely agree with the Honourable Lady, who is, of course, one of my co-chairs on the all-party group for HIV and AIDS and has done so much to promote this issue, particularly among difficult to reach groups among the BME community and amongst women, and I commend her for that. But I agree absolutely with her. Taking a test, as I've done many times myself, is a routine matter which involves merely essentially the pricking of a finger and delivering a small amount of blood, for which you can then return anonymously, get your own result back without anybody else being involved, but also knowing that if there was to be any issues arising from that test, there would generally be a proactive and supportive contact with you. And that's why normalising HIV testing is crucial if we're to find the 5,000 people across the UK who are living with undiagnosed HIV. And central to that is opt-out testing in emergency departments. And I'm proud that with parliamentary colleagues on the all-party group and with the help of Sir Elton John and amazing campaigning of other HIV charities, we won the case for a £20 million investment in opt-out testing in England in 2021 and a further £20 million for expansion to 47 more A&Es in 2023. And since its routine introduction in 2022, opt-out testing has been an incredible success in normalising HIV testing within the health sector. Across 34 emergency departments over just 2 years, nearly 2 million HIV tests have taken place. In its first 18 months in London, Brighton, Blackpool and Manchester, more than 900 people were newly diagnosed with HIV or found those who had been lost to HIV care. A further 3,000 were found to have hepatitis B or C. The approach also relieves pressure on the health service. Data from Croydon University Hospital found that when they first started opt-out testing, the average hospital stay for a newly diagnosed HIV patient was almost 35 days. With 2 years, the average stay was just 2.4 days. I'm proud also that the last government was the first funded opt-out testing, and I'm pleased that in November the Prime Minister announced further funding to see further testing intervention period extended. This will bring the total number of hospitals funded to routinely test anyone who has their blood taken in the emergency department for HIV to 89. Now, as a Scottish MP, I would want to be able to tell you about how we are leading the way in addressing the HIV epidemic in Scotland, but unfortunately that's not quite the case. Of course, there are good news stories. Early action to make PrEP freely available on the NHS has helped drive down new transmission of HIV in Scotland. Year-round, everyone in Scotland has access to free at-home HIV testing through Terence Higgins Trust testing service funded by the Scottish Government. And in 2023, we saw a landmark campaign delivered again by the Terence Higgins Trust that addressed the stigma that we all know surrounds an HIV diagnosis. It's astonishing that this campaign was the first of its kind since the Tombstone adverts 4 decades ago, and I hope this important work to combat HIV stigma continues in Scotland and across the rest of the UK. It cannot be a one-off. However, the reality is that for all this success, the progress towards achieving a historic feat and ending new HIV cases in Scotland by 2030 is now at risk. I've already mentioned the resounding success of emergency department opt-out testing in England and the role that that will play in helping get the NHS in England back on track towards reaching 0 new cases of HIV by 2030. However, the clear evidence is that opt-out testing works, and yet Scotland is still to adopt the same universal approach to HIV testing. As it stands, in Scotland, there is no area designated of high prevalence, such as Glasgow and Edinburgh, that is currently benefiting from the opt-out testing programme. And I have written again to Scotland's Health Minister, Neil Gray, to ask that this be reconsidered. There are an estimated 500 people living with undiagnosed HIV in Scotland, and a growing population of people who are living with diagnosed HIV but are no longer accessing vital treatment and care. If we're to succeed to getting our 2030 goal across the UK, we must reach each and every one of those people. Every day, the emergency department opt-out HIV is not on offer. Opportunities to find and support people living with HIV are being missed. So, although Scotland is clearly not within the Minister's remit, I hope that she, the Public Health Minister and the Health Secretary will use opportunities to raise this issue with the Scottish Government, indeed to highlight their own successes. As she may know, the Scottish Government are very keen to highlight what they perceive to be health failures in England. I think this is a great opportunity to highlight a health success and to call them out on their own approach. And that also applies to this HIV testing week. I believe to be at its most effective this week should be a week that applies across the whole of the United Kingdom, so that we can benefit from the very positive publicity that came from the Prime Minister's test. That's not available to people in Scotland because HIV Testing Week is not happening this week in Scotland. And despite my excuse me, calls last year for HIV Testing Week to be extended into Scotland, it didn't happen. And indeed, there is a testing week in Wales, but it's not as coordinated on a UK basis as I think that we would want to see, and to benefit from the promotional campaigns and the excellent campaign that there was here in Parliament this week, which the Terence Higgins Trust facilitated for members of this House. So whilst I very much recognise the work that Terence Higgins Trust Scotland and Waverley Care, who I had the great pleasure of visiting at their premises in Edinburgh recently, are doing a great job. We need, when we say that we have a national HIV testing week, it needs to be across the whole of our United Kingdom. Testing is the only way we know that we can find your HIV status, and that's why the campaign, that's why the testing week, and that's why interventions like opt-out testing are so integral to our HIV response. We're now 5 years away from 2030, and in no part of the UK were we on track to achieve our goal of ending new cases of HIV. Getting there will require working across party, which has always been the case in the APPG for HIV, AIDS and sexual health, which, Madam Chair, has the highest number of members of any APPG in this Parliament, and has been around for over 30 years. We work tirelessly in that group, and I know many members across Parliament do, so that we can ensure that we reach the 2030 goal. And I'm sure the Minister will tell us more about what is being done in her response. And I know it is not directly within her remit, but it would be remiss of me on this occasion not just to mention testing in other countries. We've heard about the HIV Testing Week here in the UK, but poorer countries rely on the Global Fund in particular, PEPFAR, which they fund along with the US, to deliver testing and deliver treatments. Now, we know that the future of funding from the US is at best uncertain. This country has always been at the forefront of the Global Fund, and that's why leadership on this year's replenishment is very, very important. I was very pleased to hear what the Prime Minister had to say yesterday in relation to Gavi and vaccinations, and I hope that he will be at some point be able to give a similar commitment in relation to the Global Fund, because I hope all members would agree it would be quite wrong if we were able to achieve the target here in the UK and just left poorer countries, the rest of the world, to get on with it themselves. And in fact, the result of that was going backwards. So I make that call in relation to the wider issue, but again, circling back to my opening remarks, I encourage anyone who's to take a test. It's very straightforward, it's very easy, and it will help identify those people who we don't know about at this stage, and help us achieve that 2030 goal.
I remind members that they should bob, as you are, if they wish to be called in the debate. Given the number of members wishing to speak in this, and to ensure that everybody gets to say what they wish to, I would suggest an approximate time limit of about 5 minutes. We will move to the front benches at 2:28 p.m, approximately. The question is that this House has considered HIV Testing Week. Jim Dixon.
Thank you very very much, Dr. Alan Khan. It's a pleasure to serve under your chairship. Can I pay tribute to the member for Dumfriesshire, Clydesdale and Tweedale on securing this important debate and for his excellent speech to open it. We are here because of the work done by the excellent Terence Higgins Trust, who with the Department of Health and Social Care run the vital National HIV Testing Week campaign. This provides a vital staging post towards the goal we all share of ending new HIV infections by 2030. And this week, as has already been said by the member introducing the debate, anyone can order a free postal HIV test, and I encourage anyone listening to do so. And I personally was very pleased to be able to take a test myself just next door on Tuesday at the excellent event run by the Terence Higgins Trust. I very much welcome the goal that was set by the last government to end new HIV cases by 2030, and I'm really pleased that the new Labour government has commissioned a new HIV action plan for England, expected to be published in the summer, to make that a real prospect as we approach 2030. As other honourable members, I'm sure, will agree, if we are to meet this ambitious target, it's crucial that we find the estimated 4,700 people living with undiagnosed HIV in England and obviously across the UK as well, and ensure they are getting the life-saving treatment they need and ensure they can't inadvertently pass on the infection. And it's clear this will only happen through testing. In my previous life as Cabinet Member for Health in Lambeth, we worked very closely with the Elton John AIDS Foundation to introduce the world's first social impact bond focused on bringing people living with HIV into care. We work with a coalition of third sector organisations across the three boroughs of Lambeth, Southwark and Lewisham, ensuring that health settings earned outcome-based payments each time they identified someone either newly diagnosed with HIV or who had stopped treatment and linked them back into care. And our brilliant GPs across the three boroughs carried out opt-out testing to accompany this set of changes. And the results were dramatic. Over 3 years, more than 265,000 people received HIV testing, and more than 460 South Londoners living with HIV entered treatment. More than 200 people received a new HIV diagnosis and attended their first treatment, and 250 others who had stopped treatment returned to care. And I'm proud of the work done across local government in the fight against HIV/AIDS. In Lambeth, for instance, the council have led London boroughs on commissioning of the London HIV prevention programme. We were in the forefront of the successful campaign to get PrEP provided free on the NHS for all those who needed it. And the council continues to jointly commission with our neighbouring boroughs work with marginalised groups to reduce stigma and thereby increase awareness of HIV and the need to take tests. I absolutely support the government's aim of ending new HIV cases in England by 2030, supplemented, and I think this needs to be said, by the Mayor of London's great work ensuring that the capital is a fast-track city. But I have to say, in agreement with the honourable gentleman, that date is only 5 years away, and I worry that without a dramatic increase in testing, we won't get there. So I'm personally very pleased to see the announcement last month by the government of an expansion of the number of hospitals carrying out HIV opt-out testing, including Darrant Valley Hospital in Dartford in my constituency, and I really welcome the service that will be made available to my residents as a result. I hope that when we see the new HIV plan for England that comes this summer, it will build upon this expansion and it will bring the increase in opt-out testing we need to find all those unknowingly living with HIV. The incredibly welcome 5.4% increase in public health grant for 24-25, that's £200 million, and that's the most we've seen in terms of an increase for very many years, will strengthen this work alongside so many other areas in which we need to tackle health inequalities. And I'd like to end by paying tribute to all the charities working so hard to tackle this issue, including but not limited to the Terence Higgins Trust, the Elton John AIDS Foundation and the National AIDS Trust. Thank you very much, Madam Chair.
Bel Ribeiro Addy.
a pleasure to serve under your chairpersonship. I'd like to congratulate the Honourable Member for Dumfriesshire, Clydesdale and Tweeddale for bringing forward this important debate and for the work that he continues to do with my honourable friend and neighbour on the APPG. And as we spend most of this afternoon's debate speaking of the goal to end new HIV transmissions by 2030, I feel it's important to recognise just how far we've come in terms of our understanding of HIV and treatments for it and our education and awareness raising of it, because we've seen so much progress in the fight against HIV since the 1980s crisis. And whilst there is still a way to go, it is through open discussion, such as the one we're having today, that we've been able to reduce the number of HIV cases in the UK down to an estimated 113,500. But it is thought that, as you've heard already today, that 4,700 people are unaware that they are living with HIV. And that is why it's vital that we continue to push to increase testing, because we know that when caught early, HIV is treatable and the quality of life of those living with HIV is far better than what it was back in the 80s. But it's the unknowing carriers that not only risk not getting the treatment they need or getting it too late, but they also risk unknowingly affecting others. Testing is easy, it's quick, and it can save lives. We also know that testing among men who have sex with other men is high, and this is incredibly encouraging, but we must do more to increase testing among heterosexual men, heterosexual and bisexual women, and the trans and non-binary community. The stereotype that HIV is only something that affects men who have sex with men is not true. In fact, the increase in infections in 2023 was attributed to sex between men and women, with a 35% increase amongst heterosexual men and a 30% increase amongst heterosexual women. So we should be doing more to encourage testing amongst all groups. And that means greater investment in local and community-based public health initiatives. So I'm really pleased that this is what this government are doing, investing in local government public health. And I'm particularly pleased to hear about the £38 million which is being awarded to my borough of Lambeth, which will go a long way towards supporting people with HIV and preventing HIV, as well as funding other vital public health initiatives that the borough runs. My honourable friend spoke earlier about the important role that councils play, and it is a crucial role indeed. It encourages testing, and councils are well poised to target the communities and areas where, with increased awareness and tailor messaging in the way that it is needed. Now, the work of local councils and community-based organisations has really helped to increase testing rates and reduce stigma, and it's also helped to ensure that as many people as possible know their HIV status. And with this recent round of government funding, it's going to go a long way to continue supporting that work. But I do hope to see more from this government on the international front, actively looking to support international efforts to stop HIV transmissions, especially at a time when President Trump is running his reckless review of American aid and has put the future of the US President's emergency plan for AIDS relief in the balance. Any credible attempt to end HIV transmission must include a global response. And when it comes to ending HIV transmission, we are not an island. Ending new cases here will only last for so long if we're not contributing to efforts to end them abroad. So where the US is stepping down from efforts to tackle global HIV transmissions, we should be stepping up. As it stands, we're already not on track to reach our target of ending new cases by 2030, but I hope that today we will hear some insights from the Minister on the steps the government is taking to increase testing and end new cases in the UK and abroad. And I very eagerly await, as I'm sure other honourable members will be also, the government's new HIV action plan later this summer. Thank you.
Sian Berry.
Thank you, Chair. It's a pleasure to serve under you for the second time this week. It's great to see you there. I'd like to thank the Honourable Member for Dumfriesshire, Clydesdale and Tweeddale and the co-chairs of the APPG for all their work that they do. I would also echo calls from Honourable Members for the funding for global work that is being shamefully cut back by the new US government to be found from what we can do within this country. And I would also ask the Minister to look at the pressure that's also being put, the funding that's also being withdrawn from wider rights-based groups that we spoke to yesterday in a really, really fantastic and interesting roundtable. There are many groups working in the Global South whose work is to support LGBT rights, but also to support reproductive rights, and that includes healthcare. And so the impact of this cutback more widely will be a health impact. And I do believe that we owe it to those groups to make sure that we're doing what we can to make up for what the American government is so awfully doing. I'm really pleased to join this important debate and to support HIV Testing Week. I absolutely commend the efforts being made by so many MPs, including the Prime Minister, to promote HIV testing. It's really, really great to see. And as an MP for Brighton, I'm so proud of the work of the Terence Higgins Trust, who are partly based in my constituency, not far from my constituency office, in making this a bigger and bigger event every year and more inclusive. I've recently visited THT to see firsthand the incredible work they're doing to end new transmissions of HIV and supporting people to live well with HIV and challenging the stigma and all the things that go around that as well. Their work with partners in my city, like the pioneering Lawson Clinic at the Royal Sussex County Hospital and the local HIV charity Sussex Beacon, it's all so exciting. As mentioned about opt-out testing, the emergency department at the Royal Sussex has been doing this testing since March 2022, and this was rolled out since nationally just in areas of very high HIV prevalence. But in Brighton, what we've seen is the team at the Lawson Clinic have identified 16 new HIV diagnoses in recent years, and that sounds like a small number, but the impact for each individual is absolutely massive, and these are all people whose HIV will almost certainly have gone undetected up till then. So all the work that's being done to normalise testing as part of a trip to A&E when blood is drawn does so much to reduce HIV stigma as well, and really does help people and save and improve lives. Brighton also has some really groundbreaking digital pathway work happening. The locally co-designed HIV app Emerge has been a big success. This is a European project centred in Brighton, and I'm told people absolutely love it, in that there's about 720 people using it for PrEP access, appointments and support. And this innovative approach has helped ease the pressure on local services, freed up about 1,000 local appointments per year. That's fantastic work, making all our money go further and really helping people to cut their transmission risk without fuss and bother. That's what we all need to be working towards. And let's be clear, zero transmission of HIV is possible by the target date of 2030. The work in Brighton that I've just described proves it, and I truly believe that Brighton could be the first place in the UK to achieve this target with this comprehensive work going on. Now, I know the Minister and the honourable members in the room are aware of all of this, and I hope that the Minister at the end of today will set out how a rollout of this model across the UK will be funded. Thank you very much.
Just in order to be able to get everyone to speak in what is a very important debate, I would like to gently suggest a time limit of 3.5 minutes now. I'd like to call Paul Davies.
Thank you, Madam Chair. Pleasure to serve under you, and I will certainly try and keep to the 3.5 minutes. As we mark National HIV Testing Week, we unite to promote regular HIV testing, particularly amongst those most affected. Despite significant progress, we are advised by the Terence Higgins Trust, National AIDS Trust and Elton John AIDS Foundation that, as already has been said, we're not on track to meet the goal of ending new transmissions of HIV by 2030. The latest data from UKHSA shows a plateau in the decline of transmissions among gay and bisexual men and a rise in new transmissions outside of London. To reverse this trend, we must scale up HIV testing and find, as again has already been said, the estimated 4,700 people living with undiagnosed HIV in England. The Brunswick Centre in my area plays a pivotal role in this effort. Their work in providing support, education and testing services is of huge value. They offer a safe space for individuals to get tested and receive the care they need. By partnering with local communities, the Brunswick Centre ensures that everyone has access to life-saving information and services. I join the HIV community in calling on the government to invest in year-round online HIV and STI postal testing services and to continue opt-out HIV testing in emergency departments. We must also address the stigma that prevents many from seeking care. Everyone living with HIV deserves to feel safe and supported in every healthcare setting. On the issue of stigma, I must commend my senior parliamentary officer and the Secretariat for the APPG on HIV, AIDS and sexual health for their outstanding work in combating stigma and educating us on the necessary actions we must take to address this crucial issue. Together with the dedication of organisations like the Brunswick Centre, Terence Higgins Trust and others, we can achieve the goal of ending new HIV cases by 2030 and be the first in the world to do so. Let's make HIV testing a routine part of healthcare and ensure that no one is left behind. Thank you.
Florence Eshalomi.
Thank you, Dr. Alan Khan. It's a pleasure to see you there and to serve under your chairship this afternoon. I want to start by thanking Terence Higgins Trust for partnering with the Labour Africa Network to host a fantastic event on Monday, which highlights why it's so important for us to continue in testing, and it's especially getting the communities who don't often come forward to test. So it was good to hear so many different people at that event highlighting why it's so crucial. And that was the new Public Health Minister's first engagement as well, a really good event for her to attend. I also wanted to highlight the visit that I conducted with my honourable friend, the member for Clapham and Brixton Hill, over 2 years ago now, in February 2022, when me and her and the honourable member for Lewisham East visited University Hospital Lewisham to look at their opt-out testing. And what struck me from that visit was the age of the person that they found that had been lost to HIV. I think the elderly woman was in her 80s. This is why it's so important to test. I thank all the honourable members for their comments already, and to thank my wonderful co-chair, the member for Dumfriesshire, Clydesdale and Truesdale, for his opening remarks and speech on this. But I want to focus my remarks on the critical issues which affects our communities. I want to talk about HIV and its impact on the black communities in the UK. Now, despite significant advancement in HIV prevention and treatment, black communities continue to face disproportionate rates of HIV diagnosis and late detection. This disparity is not just a statistic, it represents the lives affected by systematic inequalities, stigma, and a lack of culturally appropriate services. I want to highlight the work of the London HIV Prevention Programme, LHPP. They are taking vital steps to address the disparities through the new outreach work aimed at black Londoners. This programme, under the banner of Do It London, is designed to increase HIV awareness and encourage regular testing to provide robust support for those living with HIV. By partnering with trusted communities, they ensure that their efforts are culturally sensitive and effective. I want to give a shout out to Mark Thompson, the lead commissioner for LHPP. He brings his personal passion and lived experience to this initiative. As a black queer Londoner and HIV activist, Mark understands the unique challenges our communities faces. His dedication is a testament to the importance of having voices from within the community leading the charge. I also want to put on record my thanks to Fast Track London, One Voice Network, NAS, LGBT Heroes, Metro, Positive East, Sophia Forum and the 4M Network for the work they do, providing services not only in my constituency but right across London. We need an approach that's informed by the communities affected. Do It London are leading the way by allowing black Londoners to shape the services designed to them. It will be relevant, and we must also recognise that HIV is not just a health issue but a social issue. Black communities have historically been underrepresented and in the prevention and support. We must build the trust addressing black HIV services and how we address the outdated stigma. By prioritising these efforts, we can reduce HIV rates, improve health outcomes for black communities, and together we can create a service that works towards ending that goal of no more HIV by 2030.
Jim Shannon.
Thank you, Madam First of all, can I congratulate the honourable member for Dumfriesshire, Clydesdale and Tweeddale, I think it is actually, for leading today's debate on this issue. I'm a party's health spokesperson. I do make it my business to come to health debates. Indeed, I think I've only missed one debate in relation to HIV in all my time I've been here in 14 years. With health being a devolved issue, Madam Chair, there may be different guidelines surrounding access to testing and testing itself, but the fact of the matter is we all have the same goal wherever you are in this great kingdom of Great Britain and Northern Ireland. England could be the first country in the world to reach the goal, and we are currently not on track. So maybe when the Minister is summing up, perhaps the Honourable Lady can tell us exactly what action will be taken to ensure that that happens. In Northern Ireland specifically, testing has been a significant increase in recent years, with efforts actively being made for early intervention and treatment. The Public Health Agency in Northern Ireland revealed that in 2023 a record of 92,635 tests were conducted for a population of 1.9 million. I think that's very significant, and I think we all recognise that. It's a 5% rise in 2022, and this, I believe, is a massive commitment by us for where health is devolved to ensuring that there clearly is early detection. On the other hand, Madam Chair, the number of new HIV cases have also risen in that year of 2023, where the figures come from, some 167 men and 34 women, a 40% increase from 2021. But one of the alarming cases is, and I know the numbers are small, but they are percentage-wise quite worrying. It came from those linked to injecting drugs. And again, maybe the Minister can give us some idea how we can address that specific. It's not all about physical exchange, it's about the use of drugs as well, and what can be done to stop that. Sharing a needle has been the reason for HIV for some drug users, and it does give me concern. The honourable gentleman, when he set the scene, referred to the 70s and 80s. And I'm of an age that I can remember them very well. But historically, HIV was a stigma. And who helped to take away some of that was Princess Diana. I always remember her. I remember that she met them, she sat alongside them, she shook hands with them, she drank out of the same teacup and all. And these things did dispel some of the concerns that people had, and we thank her for that. Testing for HIV, of course, must be discreet. And again, there are numerous sexual health clinics across Northern Ireland, indeed the United Kingdom, that offer sexual health advice and testing. In addition, far more discreet testing. Self-testing kits are available, and I think those are some of the things that we should be looking at as well. Early diagnosis is the key to ensuring that treatment can be started quicker. Treatment can also reduce the viral load, meaning it becomes untransmissible. And I want to, if I can, just because others have referred to the Honourable Lady and the Honourable Gentleman referred to the HIV in third world countries, and I agree with their sentiments entirely. But I think of the Elim Church in my constituency of Strangford, where they have a specific task where they deal with some of the HIV people in Swaziland in Africa. And that choir comes over every year to do some fundraising. And every one of those young children with lovely voices have all got HIV, received it from their parents when they were young. But the point I'm making, if I can, Madam Chair, is this. The good thing about it is they now are HIV-free as long as they have the drugs. So there is a way of going forward. So I conclude with this. Charities, agencies and church organisations do their best to support. I've seen them. I understand what they can do, and we all understand that. And I would look very much forward to hearing from the Minister, and I hope that the Honourable Lady can parallel her counterparts in the devolved nations to ensure that we can tackle together HIV and meet our 2030 goals also together. Thank you.
Alex Barras-Curtis.
Thank you, Dr. Allen. It's a pleasure to serve under your chairship, and I pay tribute to the Honourable Member for his speech and for securing this important debate. And it is indeed an honour to take part in this important debate, particularly this week during National HIV Testing Week and following such excellent contributions from all members and across all sides of this chamber. As the Member of Parliament for Cardiff West, it would be remiss of me if I didn't discuss the proud role Wales has to play in this debate. Wales has a proud role in responding to the AIDS epidemic and the ongoing support of people living with HIV. Indeed, Terence Higgins Trust gets its name from a Welshman who once worked in this place for our friends in Hansard. It was co-founded by Welshman Martin Butler, OBE, and continues to be the leading charity for supporting people living with HIV in Wales, without an ounce of Welsh Government funding. Without them, Wales would not have an HIV action plan and its important 30 actions. Without them, we would not have this National HIV Testing Week, which brings us together today. And so I pay tribute to the work their staff and advocates do. As has been said in this debate, what the Prime Minister did this week has set a huge example, not just here in the UK, but across the world. By taking an HIV test and talking about the importance of doing so, destigmatising it, he has used his good office to speak to everyone in our country and across the world and taken down some of the barriers for ordering an HIV test and letting people know they are available. When Terrace Higgins Trust polled the general public, 80% were unaware that testing at home from a kit sent in the post was even possible. But when offered this choice against others, home testing was by far the preferred option. Now, thankfully in Wales, we have the Labour-run Welsh Government that provides at-home self-sample testing kits all year round. Contrast that to England, where they are only available nationwide for 1 week of the year or authority by authority as budgets allow, as has been said. Our friends at Public Health Wales are going above and beyond to get kits to people and providing charities, communities and pharmacy partners across Wales with take-home kits that people can post off to receive their results. This is a great innovation that others can learn from. And in addition, in my area, GPs are texting their patient lists, offering tests to those who want them. And the Welsh Government has also committed to funding Fast Track Cymru to establish networks across all health boards. However, one area where Wales is falling behind England is in respect of opt-out testing. Thanks to the Prime Minister's World AIDS Day announcement of £27 million, over 50 A&Es in England are routinely testing for HIV and hepatitis, and this will rise to 90 by the summer. However, not one A&E in Wales is yet doing this remarkable innovation. So I asked the Minister if she could join me in working with the Welsh Government to seek their endeavour to change this approach. I want to finish my contribution with a call for the Minister to unlock a UK-wide problem, namely getting PrEP available outside of sexual health clinics. Yeah. In Wales, 5,157 people have been prescribed PrEP at some point since 2009, but sexual health is a bottleneck service to start PrEP. For many, this could be done online, but for too many people in Wales, this is not the case. There are rules and regulations stopping PrEP being dispensed, not even prescribed in community pharmacies. So I asked my honourable friend to take a look at this issue and to use her good offices to tear down these barriers. Otherwise, that 2030 goal will have been missed. Thank you.
Yeah. Kevin McKenna.
Thank you, Dr. Alan Carr. It's a pleasure to serve under your chairmanship. And massive, massive thank you to the honourable member from Dumfriesshire, I'm going to get this right, Dumfriesshire, Clydesdale and Tweedale for calling this debate. Everyone involved in the HIV, APPG, and everyone's already mentioned, from Terrace Higgins Trust to the Elton John AIDS Foundation. And actually all of those small, everyday champions, people who are positive, people who have been allies of people who have been positive, everyone who's worked in the bioscience sector, everyone who's worked in the health sector, this has been a collective effort of thousands and thousands and thousands of people in this country to get us to a point where we're only a few years off potentially eradicating all new transmissions of HIV. And as I would also say, as the honourable member in opening this debate mentioned, it's also LGBT History Month. I think we're used to, in the LGBT community, having a lot of clashes, whether it's Pride happening at the same time as Wimbledon and Glastonbury, we're just used to it. It has put me in a very reflective mood. Actually has us so being elected to Parliament and moving from nursing into this world. I was 11 when I realised I was gay. That was in 1985. It was just as everything was hotting up around the AIDS pandemic. It wasn't a very... it was a pretty scary world to step into. By the time I was properly coming out in the early 90s, I met lots and lots of friends, but friends and lovers who had AIDS or HIV. I spent a lot of time going to hospitals, and it was there that I realised that actually nursing would be something that suited me. So actually it was partly in response to the AIDS epidemic that drove me along the career path that I did. I also remember the abject terror of getting early HIV tests, particularly before I was a student nurse. It's like it could have stopped that career dead in its tracks at that point. So I think I've lived like I'm not going to comment on everyone in this room's age, but I've lived like many people in this room right the way through this pandemic. And of course, by the time I was finally diagnosed with HIV, it had changed again. But that's still 20 years on. So I've lived a long time as an HIV positive man. I've lived a long time in my life, you know, starting off with friends taking tablets that did have quite severe side effects, some side effects that actually were very unpleasant and actually led to them still suffering from HIV and then AIDS. But at the same time now, it's whittled down to 1 tablet a day. And as I get into my 50s, it sits alongside my statins and my arthritis medication, all the other medications that we all have at a certain point in our lives. And that's the difference. Yes, absolutely.
I commend him so much for his passionate speech and his lived experience. Earlier this week, I attended another event, and Elton John's AIDS Foundation was there, and Richard Payne, who leads on there, he's one of the directors, mentioned that wouldn't it be great that in a few years we could have an injectable form of PrEP? Does he think that that's the advancement we need to see to help address HIV?
Thank you very much for that intervention. I mean, yes, we've already got injectable forms of HIV medication, particularly for people with chaotic lifestyles. They only need to take a jab once every couple of months. It's a real way forward that will further help us eradicate this. I've also been reflecting actually in my nursing career, those patients I've nursed for who didn't know that they were positive, who became incredibly sick. They developed AIDS without knowing that they were positive, coming straight into an intensive care, waking up to find out that they were positive. Massive disruption to them and their families, and it was stigma that was driving that. And people don't have to live that way. People don't have to suffer that way. So a very strong message today is, honestly, everyone just get tested. Get tested, everyone do it, it's absolutely fine, it is just a little scratch on the finger. And there should be no stigma. You won't pass this disease on when you're treated. You won't actually suffer, and honestly, it's boring and mundane. And I think in the community of gay men, it's been very boring and mundane for quite some time. I think in wider communities, just catch up with the rest of us, frankly. If everyone's tested, we'll get there. The one thing I would say to ministers is actually opt-out testing has been extremely successful. There are diseases out there, like hepatitis C, that can be completely eradicated. You don't have to be on a tablet for your whole life, you're just a few weeks course. If we can identify those people through opt-out testing, we can tackle several diseases with one effort and eliminate those as well. So I'd really like to hear that going forwards from the Minister. Thank you very much.
Steve Race.
Thank you, Dr. Chairship for the first time, and I congratulate my good friend, the member for Dumfriesshire, Clydesdale and Tweeddale, for securing this debate. The world is a difficult place for many in the LGBT plus community today, a time where solidarity is necessary and progress is needed. I hope beyond hope that young people in Exeter not experiencing what I remember as a young gay man before we made such progress under the last Labour government. I'm heartened that schools such as Westex School in my constituency have their own Pride celebrations, but I do look with sadness at America, where I know that people who are LGBT feel under siege once again. It feels hard, but on a daily basis we remind ourselves that we are not America, and we do not live in America. He is not our president. In fact, we have very different leadership here. While Donald Trump is showing the example of American power, our Prime Minister is showing the power of our example. I was proud that this LGBT History Month, this National HIV Testing Week, my right honourable friend, the Prime Minister, took an HIV test for the world to see. Not only has it been covered on every channel here, it has been broadcast across the globe. And let us be clear, we must tackle HIV infections here in the UK, and this government is taking a pioneering approach, but it's equally important to tackle infections globally too. And that relies on an unflinching commitment to defending and extending human rights. The global HIV pandemic has demonstrated the importance of addressing human rights violations as a central tenet of driving down HIV rates. Studies have consistently found that HIV policies grounded in human rights achieve superior results over those that are not rights-based. Among gay men and other men who have sex with men, HIV prevalence is 5 times higher in countries that criminalise same-sex sexual acts than in those that do not. Access to testing is improved by decriminalisation. In sub-Saharan Africa, gay men and other men who have sex with men have double the odds of ever taking an HIV test in countries that have legalised same-sex relations compared with countries that have not legalised same-sex relations. But human rights are increasingly under attack from authoritarian governments and others, and otherwise democratic governments whose elected leaders choose to vilify minority groups for political gain. This makes it all the more important that the UK government takes a global lead in advocating for human rights if we want to reach our commitments on eradicating HIV transmissions. I believe the UK should work with other like-minded donors, including France, Canada, Germany, the European Commission, to fill some of the gaps in funding that may emerge in the global response. This means ensuring strong commitments to the Global Fund to fight AIDS, TB and malaria. And I welcome that on the subject of the Global Fund, the Prime Minister, in an answer just this week to the Right Honourable Member for Sutton Coldfield, stated that he has long supported it and will continue to support it and will share details just as soon as he can. The UK could also help fill the global gag gap, agreeing a joint plan to respond by focusing aid and diplomacy on human rights and building inclusive healthcare systems. The UK could commit to adding HIV to the agenda of meetings with other world leaders throughout 2025, including with President Ramaphosa on the sidelines of the Canadian G7 to agree how best to use South Africa's G20 presidency to turbocharge prevention of HIV and AIDS. The government could empower UK ambassadors and high commissioners to prioritise protecting universal human rights as part of its commitment to tackling HIV, AIDS and to global health security. Madam Chairman, I want to pay tribute to Terence Higgins Trust for the amazing work that they're doing, not only getting the Prime Minister to test, but in their efforts to get the country back on track for ending new HIV cases by 2030. Imagine the victory it will be if we can end this epidemic in the UK and be the first country to do so. It will change many lives forever and inspire action everywhere around the world. Thank you very much.
James Asser.
Thank you, Dr. Alan Khan. A pleasure to see you in the chair. And I also thank the Right Honourable Gentleman, the member for Dumfriesshire, for securing the debate and for all the work he does on this. It is very much appreciated. We've just had another successful National HIV Testing Week, and I'd like to join others by paying tribute to the Prime Minister for his participation. That will be a huge boost in awareness raising. And also thanks to the Terence Higgins Trust for their work on this and for focusing us on the 2030 goal. My own journey in campaigning in this started over 30 years ago at university as we worked to fight the stigma around HIV in what was a very different era, as so effectively outlined by my honourable friend, the member for Sittingbourne and Sheppey. Ours, is the generation that came out just after the generation that lost so many to AIDS and into a world where so many were still losing their lives and before effective treatment. But on the cusp of the era that now knows living with HIV to be a long-term condition. Yes, progress is often fraught with challenges and difficulties, but nevertheless, if we test people, find people previously undiagnosed, treat people, they will have a normal life expectancy. How things have changed. The magnitude of the 2030 goal can never be lost on us. To be a country that ends the onward transmission of HIV is a massive task. Think how it will change dating in this country, how it will change relationships in this country. Think how it might change how we treat each other. Then to think we could be the first country in the world to make it happen. This would seem like a miracle to all my friends when I turned 18, and it would be British excellence on a global stage, social justice and impact aligned. And then to think if we were to achieve such a remarkable goal, it would be the first time we stopped the onward transmission of a virus without a vaccine and without a cure. We cannot afford to fail. And there's lots to be encouraged about. Firstly, this has cross-party support, which is welcome, and I pay tribute to the previous government who did much to enable opt-out testing in A&Es across the country. And I think we're also all delighted to see the new government back that up with the £27 million announced in December that will enable this highly effective programme to take place in 90 A&Es from this summer. However, we have to acknowledge that our friends in the voluntary sector have to continue to reach targets with fewer and fewer resources. We all know the pressures that they're under. And take the infrastructure between National HIV Testing Week. When Labour last left office, the Department of Health was making available £4 million to do HIV prevention in our communities. Today, the Terence Higgins Trust and their 30 local partners run all that you see for National HIV Testing Week with just £1.1 million a year. And that follows a period with the cost of living and double-digit inflation. These are impressive efforts, but ultimately they're not sustainable over the longer term. It is welcome to see the Department of Health website is saying that the programme will be commissioned for a further 2-year period. But the budget is tight and the pressures are there, and we do need more than 2 years. I understand that is the situation my honourable friend, the Minister, has inherited. But as we get nearer and nearer to 2030, this programme cannot stop. It needs to be ramped up if we're to reach the epic goal and leave no one behind. So I am extremely optimistic of what we can achieve. I know the government is committed to achieving more, and I know my honourable friend is absolutely dedicated to that. But I always like to leave things with a request for the Minister, and I know they're all thrilled when I do. So I would urge my honourable friend to look at what can be done to provide more resources and more finances so we can ensure that we hit that vital 2030 target.
Dr. Scott Arthur.
Thank you, Chair, and it's a pleasure serving under you today on the last day before recess. And I want to thank my honourable friend from Dumfriesshire, Clydesdale and Tweeddale for bringing this debate to us. And I think him opening the debate is a reminder that HIV isn't just an issue in our big urban centres. In October, I visited Waverley Care's headquarters in Firhill in my constituency of Edinburgh South West and was deeply impressed by their work. Established in the 1980s, Waverley Care bravely opened the UK's first purpose-built AIDS hospice, Milestone House, responding to the then emerging HIV/AIDS epidemic in Edinburgh. Milestone House faced initial opposition, reflecting the fear and stigma surrounding HIV/AIDS at the time, which we've heard about. And I've heard first-hand accounts of this, including from a former Firhill High School pupil who recalled visits to the centre and the subsequent backlash in the media. Work placements had to be ended due to this misleading reporting. And it pains me that, back then, some of the LGBT community found that hate as a barrier to seeking help and also seeking testing. And it really pains me that today some of the trans community face the same bigotry, and it's a barrier for them seeking testing and also seeking PrEP. We must acknowledge the courage of individuals at the time, though, and I want to include in that Councillor John Allen, who represented Oxgang's ward. And he wanted it to come to his ward when other councillors were doing all they can to stop it coming to them. So I want to thank him for his leadership. The turning point in terms of opposition to the centre locally came when Princess Diana visited. And she visited many hospices. Her simple act of sharing a cup of tea with a visibly ill young woman sent a clear signal. The patients faced death, but they were still people and were still worthy of our respect. And I don't compare the Prime Minister to Princess Diana, of course, but what he did this week is exactly the same. Just as all of us tested this week as well and are telling our constituents about this, we're all doing exactly the same. Although it was harder to get blood out my finger than I expected, I have to say. Since then, remarkable medical advances have transformed HIV/AIDS from a death sentence to a manageable condition. In Milestone House, it is no longer a hospice. However, as was highlighted by the member for Dumfriesshire, Clydesdale and Tweeddale, the fight is not over. Shamefully, and I say shamefully, HIV testing in Scotland has decreased by 19% since 2019, and diagnoses are on the rise. Scotland lags behind England, lacking a dedicated HIV testing week and opt-out testing in our high-risk urban centres. The prevalence of HIV in Glasgow and Edinburgh is over double the trigger level for opt-out testing in England, but yet that facility is not provided. Waverley Care rightly highlights that whilst LGBT community has strong awareness, heterosexual transmission is now the most common route, often due to lower testing rates. This is why dedicated testing week and opt-out testing are so important in Scotland. Waverley Care, in partnership with THD, is leading the charge for opt-out testing and an HIV testing week in Scotland, and they've written to the Scottish Government. And I'll come back to that, I think. These measures have been proven to be effective in England. Having read the testament from Waverley Care and Terence Trigger's Trust, I cannot see how Scotland can meet its target of no transmissions by 2030. It just cannot be done. And I also can only conclude that it's going to make it much harder for the UK Government to hit its own target. I would therefore like to ask the Minister if she will write to the Scottish Government making clear the benefits of an HIV testing week and making clear the benefits of opt-out testing in our big urban centres and asking them to follow the UK Government. Thank you.
Liberal Democrat spokesperson Alison Bennett.
Thank you, Dr Alan Khan, and it's a pleasure to serve under your chairmanship today. And I would like to start by congratulating the Right Honourable Member for Dumfriesshire, Clydesdale and Tweeddale on his opening remarks and bringing this debate to this chamber. In the UK alone, around 17,000 lives have been lost to the disease. And despite what many might think, this crisis isn't over. Since 2021, we've seen an alarming increase in diagnoses. and between 2019 and 23, diagnoses rose by 56%. The situation is particularly striking in London. In 2023, our capital recorded the highest new HIV diagnosis rate of any region in England, with 980 people diagnosed for the first time. And a further 563 people were diagnosed after initially being diagnosed abroad. The latest estimate tells us that approximately 107,000 people are living with HIV in the UK today, and of these, around 5,000 remain undiagnosed, unaware of their condition. And meanwhile, even though testing rates improved by 8% between 2022 and 2023, they still remain 4% lower than pre-COVID levels. And although testing among gay and bisexual men has reached record levels, for heterosexual men, testing rates remain 22% lower than before the pandemic. For women, the picture isn't much better, with rates still 10% lower across the board than pre-pandemic levels. Globally, the situation is also critical. While we have made significant progress, with new HIV infections having dropped by 60% since the peak in 1995, 39.9 million people are still living with HIV in 2023. And tragically, 1.3 million people were newly infected last year. If we need a reminder that the battle is far from over, that is it. The majority of these new infections are concentrated in poorer regions, with sub-Saharan Africa bearing the heaviest burden. And every week of 2023, 4,000 adolescent girls and young women between the ages of 15 and 24 became infected globally, with the majority in sub-Saharan Africa. There is also a disturbing link between conflict, sexual violence, and the spread of HIV. In Rwanda, for instance, the prevalence of HIV in rural areas surged from 1% before the 1994 conflict to 11% just 3 years later. We know that this kind of impact will be felt for generations. So what can we do? The good news is there is lots we can do, but we've got to get on with it. At home, while dying from AIDS is no longer an inevitable outcome, and indeed, organisations that the Honourable Member for Brighton Pavilion mentioned, like Sussex Beacon, that serves both her constituents and mine in mid-Sussex, they're now looking to reconfigure services to adapt to changing patient needs. The alarming rise in HIV diagnoses demands stronger action to expand access to testing, treatment and education for those most at risk. My Liberal Democrat colleagues and I have long called for equitable access to PrEP for all those who could benefit from it. However, the previous Conservative government's cuts to the public health grant have undermined the delivery of vital sexual health services. The Liberal Democrats are committed to reversing these cuts, pledging to invest £1 billion annually to strengthen public health programmes, and among other things, this would help ensure we can eliminate HIV transmissions in England by 2030. We are campaigning for 5 key things. First, universal access to HIV prevention and treatment. Second, the eradication of the stigma and discrimination tied to HIV and HIV testing. And I commend the Prime Minister for making progress on that this week by taking that HIV test that many honourable members have mentioned. Third, widespread testing and education about HIV. Fourth, a clear path to eliminate transmission in England by 2030. And fifth, crucially, the restoration of the public health grant, which was slashed under the previous Conservative government by a fifth. But to tackle this problem effectively, we must also look beyond our borders. AIDS remains one of the world's leading killers despite being preventable and treatable. The Global Fund has saved millions of lives, but we must keep up the momentum if we are to defeat these diseases for good. The Labour government has reneged on its manifesto pledge to cut spending on international aid from 0.58% to 0.5% of gross national income. UK foreign aid has been a lifeline for millions of vulnerable people around the world. Cutting back on this aid is not just a budgetary decision, it's a matter of life and death. The government must commit to restoring the aid budget. This is true now more than ever, for over the course of the last month, President Trump has wreaked havoc on the international development space, withdrawing funding and dismantling long-standing international institutions. The harsh reality that the US can no longer be relied upon to be an effective partner in delivering support to the areas that need it most means the UK must step up. I and my Liberal Democrat colleagues firmly believe in global solutions to global problems. We believe in the power of international development in building a more peaceful, healthy and prosperous world. Cutting foreign aid is not just a failure to support the world's poorest, it is a failure to uphold human rights, and it does not benefit us. The Liberal Democrats remain committed to spending 0.7% of GNI on aid, prioritising developments that help the most vulnerable and aligns with our strategic objectives like gender equality, human rights and access to HIV treatment and sexual health services. The fight against AIDS and HIV is far from over, but by working together, by investing in testing, treatment, education and international cooperation, we can and we will save lives. Thank you.
Opposition spokesperson, Dr. Caroline Johnson.
Thank you, Dr. Alan Khan, and it's a pleasure to serve under your chairmanship. I would like to first congratulate my right honourable friend, the member for Dumfriesshire, Clydesdale and Tweedale, for securing this important debate today, and also the honourable member for Sittingbourne and Sheppey for sharing his lived experience of this condition. As we mark National HIV Testing Week 2025, we should be proud of the progress we've made since the 70s and 80s in raising awareness of the disease, of reducing stigma, but we must also reflect on the great challenges that remain in the battle against HIV and AIDS. I would like to pay tribute to charities like the National AIDS Trust, the George House Trust and the Terence Higgins Trust, whose work has been at the forefront of the fight against HIV and improving the nation's sexual health. The campaign strapline for National HIV Testing Week is I Test. That is a message that cannot be repeated enough. Public campaigns like this have helped to normalise HIV testing as something routine, beneficial, both for the individual concerned and for society at large. Testing is quick, easy, confidential and free. It is the gateway to prevention, to treatment and ultimately to ending new HIV transmissions. During HIV Testing Week, anyone in England can order a free postal HIV test funded by the Department of Health and Social Care and delivered by the Terence Higgins Trust as part of the National HIV Prevention Programme for England. And I would encourage anyone who is concerned to get such a test and do it. There's been encouraging progress in reducing the prevalence of HIV across England during recent years. Through introducing a National HIV Action Plan, the last government sought to achieve an 80% reduction in new infections by 2025. Remarkably, the UK achieved the UNAIDS 95-95-95 target back in 2020. That is that 95% of individuals living with HIV were thought to be diagnosed, 99% of them were on treatment, and 98% of them were achieving good viral suppression. There's been a growing proportion of HIV testing taking place by post or at home, with 44% of tests taking place in 2023 compared with 19% in 2029, which shows that these tests are acceptable to the public and welcomed by them. There's been a substantial increase in the number of tests taking place in the emergency departments, with 857,000 in 2023 compared to 114,000. And that is probably mostly taken part because of the opt-out testing introduced by the last government. But we cannot be complacent because although there have been areas of progress, in recent years we have seen a reversal of hard-won gains in reducing HIV transmission. Data published by the UK Health Security Agency in 2024 showed that the number of heterosexual men and women are newly diagnosed in England with HIV has increased more than 30% in 2022. And there are around 5,000 undiagnosed people currently living with HIV in England. And of course, HIV and AIDS are not a problem that can be solved within the UK without acknowledging the global context. Last year, AIDS-related illness claimed as many lives as did the total of all wars, homicides and natural disasters that ravaged our planet. In parts of southern Africa and countries such as Botswana and Zimbabwe, more than a fifth of the adult population is living with HIV. Such figures remind us that the global fight for HIV is very far from over. I was troubled to hear in a House of Lords debate earlier this week that the head of the UNAIDS agency has warned that global infection with HIV could increase by more than 600% by 2029 if the US continues to suspend the UN HIV AIDS programme. This will mean higher infection rates here in the UK as communicable diseases do not recognise national borders. I will give way, yes.
I thank the Shadow Minister for highlighting. Shadow Minister for highlighting that. Does she share my concern? Data and research from Elton John's Aid Foundation highlights that almost 228,000 people a day will miss out on HIV testing if this pause in USAID. And what more does she think that we should be doing collectively, across party, to call this out?
I thank the Honourable Lady for her intervention. I think the key is to ask the government what support they're going to do to support the UN, what conversations they're having with the US counterparts to discuss both the benefits to people overseas, but also the benefits to people at home from ensuring that the battle against HIV and AIDS is won. Okay.
I thank the Shadow Minister. I know that she was formerly the Public Health Minister as well, so she does care passionately about this. Does she agree that HIV has to be a cross-party issue, and does she agree that not only the government should be calling this out, but the opposition should be calling this out as well?
I think it's very clear that the battle against HIV is a cross-party issue, and it's clearly been a cross-party issue. We've seen strides and improvements over the last year with governments of different colours, and yes, as a Public Health Minister, we met at an event where I was able to announce the results of the first year of the opt-out testing and the success that it had been in reducing infections. Testing is really important, and I was pleased to see the Prime Minister test earlier this week, because I think that is helpful in reducing the stigma associated with HIV testing, because it shows that anybody in any circumstance can have such a test. And we have, using the opt-out testing, identified some cases where people were thought to be very low risk but unexpectedly turn out to be HIV positive. However, we do need to target those areas most highly at risk, and we did see that when we brought in the opt-out testing, we targeted first the A&Es at the highest risk. But in October 2024, the Department of Health and Social Care revealed that over half of diagnoses of HIV were made by those among those previously diagnosed abroad. So will the department be considering the implications of these trends when it puts together its new HIV action plan in order to achieve the goal of no new HIV transmissions in the UK by 2020? Because countries like Australia and New Zealand require applicants to take an HIV test, just the test, before they obtain a visa. So has any discussions taken part between the Department of Health and Social Care and the Home Office about introducing such requirements in the UK, such as we have for tuberculosis? OHID's own guidance, government's effectively own guidance, suggests that all men and women and recently arrived children known to be from a country of high prevalence should be recommended a test. Perhaps it would be helpful if they followed their own guidance, because if we test a high-risk population, we stand more chance of picking up more cases, and that would be beneficial. I just want to review the opt-out testing. Recent opt-out testing, which is brought in by the Conservative government, is a scheme where a patient can explicitly decline instead of implicitly accept an HIV test, and is rolled out in many A&Es across the country, and I'm pleased to hear that it's going to come into some more A&E departments. It's identified literally hundreds of people who are undiagnosed or have been lost to follow-up with treatment for HIV, and also includes hepatitis B and C. Identification of those cases helps the individual's concerns and also helps to reduce transmission across the wider population. Between 2019 and 2020, the estimated number of diagnosed cases in England declined. But somewhat counterintuitively, opt-out testing suggests there are more cases than we realise. So does the Minister have plans to re-estimate the number of cases of undiagnosed HIV that may be out in the community waiting to be treated in light of the evidence received from the opt-out testing? The opposition welcomes the commitment by the government to fund opt-out testing until March 2026. But NHS services need clarity around funding beyond this point, so can the Minister clarify the long-term funding for opt-out HIV testing will be considered as part of the spending review taking place this year? Of course, HIV prevention goes beyond testing. The other issue which comes up perennially is access to pre-exposure prophylaxis or PrEP treatment, so that reductions in HIV cases in England can be maintained. It's been described as a miracle drug which prevents HIV-negative people from acquiring the virus and is a key tool to fight the new HIV transmissions by 2030. But waiting times for PrEP are too long, at one point measured in months rather than weeks. Can I ask the Minister what steps she's taking to improve that. The last government took steps to improve access to PrEP across the country, setting up PrEP Access and Equity Task and Finish Group to provide progress. But can the Minister provide an update on what steps have been taken to implement the group's recommendations since they took office? In closing, Dr Alan Khan, we have only one Parliament left to finally eradicate new cases of HIV by 2030. We owe it to everyone who has lost their life to this virus, to everyone who has faced the stigma of being HIV positive, which is thankfully reducing but still exists, and to everyone who is living with HIV today, to end new transmissions once and for all. I hope the government continue the progress of the last government with a new HIV action plan, and I hope that will be developed soon. I know the Minister in the speech, former Minister now, in his speech in November said that the plan was in production. I hope it's getting closer to completion and the Minister can give an idea of when it will be complete. And I hope that today's debate can inspire thousands of people to get themselves tested.
Minister Karen Smith.
Thank you, Dr Alan Khan. And it really is a pleasure to serve for the first time under your chairmanship in this debate. And it has been it's such a marvellous debate to be part of. The Secretary of State has asked me to take this debate on behalf of my honourable friend, the member for West Lancashire, who has attended events this week, who unfortunately couldn't be here today. But I mean, I've known her a long time, and I know she is going to be a fantastic champion in this area, coming to the department every day to do battle on people's behalf. And I am really grateful to the Right Honourable Gentleman, the member for Dumfriesshire, Clydesdale and Tweedale, for securing this important debate, for his continued work in this area. And I've joined my friend, the member for Colne Valley, in really commending the work of the APPG here and many honourable members. I know the caught between the dilemmas of the debates today, but many other people would be here, and I know many people will be listening to this debate with great interest on what is the 4th day of National HIV Testing Week. And it does give me the opportunity as well to thank all those amazing charities and organisations who are playing such a huge part in making this week a success. The Terence Higgins Trust, the National AIDS Trust and the Elton John AIDS Foundation that we've heard about today, to name just a few. And I also want to add my voice to the enthusiasm that I've seen in my time, 9 years now, across all parties on this issue. There is a long period of cross-party collaboration. I do hope that is something that continues and that we continue to base our work on evidence and care. It is what's got us here today, and I think my friend the Honourable Member for West Ham and Beckton made that point very well, as well as asking for some more resources, so well done him. I will perhaps come on to some of that. Because with regard to National Testing Week, we are really making great strides towards the goal of no new transmissions in England by 2030. And we are, as many members have said, at a crucial point in that journey. HIV testing has been revolutionised. It's now fast, free and available in the privacy of our own homes, even when your home is number 10 Downing Street, as the Prime Minister showed us on Friday, and that has been referenced. I know that's a really powerful message, and I think my friend the Honourable Member for Exeter highlighted, not just in this country, but globally. Because when we normalise testing, we normalise prevention, we normalise treatment and care, and we normalise saving lives. And so I really want to thank every colleague who attended Tuesday's drop-in as well. It is so important for all of us in this place and elsewhere to help smash the stigma, however we can, transform perceptions and drive us closer to no new transmissions. I will give way to my honourable friend.
I thank the Minister for making a really impassioned speech, and she's doing an excellent job. She's highlighted the importance of testing and the fantastic work all the different organisations do in pushing that. Does she agree that for us to reach that vital goal of no new transmissions by 2030, we should be following with Wales' example of how we can have year-long access to online testing to help more people test and eradicate HIV by 2030?
I thank her for her comments and her great leadership in the work through the APPG as well. And absolutely, I think some of that looks very successful, and I'll come on to comments, but I think we do need to learn and share from each other. In terms of sort of reducing stigma. We've all exposed how old we are in this debate today. I am as old as the honourable member raising the debate, and maybe the honourable member for Strangford and maybe some others. I worked in the health service at the time through the late 80s. It was a gay man that started raising awareness to me about the stigma around HIV and AIDS, and we have come an awful long way. And the Honourable for Strangford and Edinburgh South West rightly talked about that role and that iconic moment that was so important with Princess Diana, which is so long ago, but to some of us it seems like yesterday. I can update colleagues so far this week that in HIV Testing Week we've given out, the latest figures I have, 13,308 testing kits. That's 1,308 people who now have the power to know their status, take control of their health and contribute to the fight to end new HIV transmissions within England. Last year, National HIV Testing Week delivered more than 25,000 testing kits, achieving great results amongst communities disproportionately affected by HIV. For example, the uptake of testing kits for Black African communities has tripled since 2021, and my friend, the Honourable Member for Vauxhall and Camberwell Green, made those points excellently. About that. The Honourable Member for Dumfriesshire, Clydesdale and Tweedale and I think the member for Edinburgh South West tempt me to comment on the Scottish Government's role in this area. But politics aside, I think there is a serious point, as highlighted by my honourable friend again, about sharing good practice. And my friend, the Honourable Member for Cardiff West, made these exact points about the role of Terence Higgins Trust. I don't think I knew that Terence Higgins was Welsh. I am married to a proud Welshman. I know this is something that we share, Madam Chair, so that's bad on us, but I didn't know that. So, but he makes an excellent point about the role of his leadership, the people that came after him, obviously, to lead that organisation. And we do need to learn and work with each other. And I do make the commitment to continue, on behalf of the department, our work across the United Kingdom to share and learn from best practice. And I think my colleagues of whatever political party across the United Kingdom would echo that. As a minister here in England, the campaign would not be possible without HIV Prevention England. This is the national HIV prevention programme funded by the government and delivered by the Terence Higgins Trust with local partners. The programme aims to promote HIV testing in communities disproportionately affected by HIV, bringing down the number of undiagnosed and late diagnosed. Every year, it runs a National HIV Testing Week and a summer campaign to raise awareness of HIV and STI prevention and testing, and much more. Now, we are committed to building on these successes, and that is why we've extended the programme for a further year until March 2026, backed by an additional £1.5 million. And looking to the future, we are making progress to end new transmissions before 2030, but we know much more work needs to be done to reach our goals, and we've had some excellent contributions on that today. Our work is not over until every person, regardless of race, sex, sexuality or gender or circumstances, has access to testing without barriers. And I absolutely hear the comments from my honourable friend for Exeter and others fear and historic fear that people have felt. We will not stop until every test is met with care, every diagnosis with treatment, and every individual with dignity and respect, regardless of who they are or their HIV status. I will.
Thank you. I wonder whether the Minister would agree with me that that while we have a cross-party consensus here today, and I absolutely accept the words of the Honourable Member for Sleaford and North Hykeham at face value, I think when you look at the history over the last 10 to 15 years of HIV action in this country, it rather paints a different picture. We might be closer to eradicating HIV transmissions if, for example, the public health grant, which was set up in 2014, had have had any increases until this government this year, 5.5% increase this year. If the National HIV Prevention Programme, which started out with a budget of £4 million in 2010, didn't only have a £1.1 million budget by last year, if, for example, the funding for the HIV helpline hadn't been abolished in 2012, and if the HIV Innovation Fund had still been around and wasn't, in fact, abolished by somewhere between Johnson Truss and Sunak psychodrama, we might actually be closer to it than otherwise we are at the moment.
Well, I thank him for that intervention, and I think my honourable friend for West Ham and Beckton made similar points as well. The shocking level of cuts to both our public services and then by implication third sector organisations and their contribution to the fabric of our society, as well as doing work that, frankly, the public sector can't get to and groups of people that it can't get to, I think is shocking. It was shocking as we went through it, and Lord Darcy's given us a good diagnosis of some of that problems. We're very much, we inherit this situation. We very much want to take forward the good work was done, but we do inherit a landscape that I wish we hadn't, but we're very much committed to making good on that and making progress, because we want to build a future where testing is routine, where treatment is available to all, where PrEP and PEP are accessible, and where no one is left alone in their journey. My older friend for Dartford and my friend for Clapham and Brixton Hill really talked about the important role and some fantastic examples of local government, because to support improved PrEP access and many other critical HIV prevention interventions, the government has provided local authority commissioned public health services, which include sexual and reproductive health service, a cash increase of 198 million compared to 24-25. This is an average of 5.4% cash increase and a 3% real terms increase. This represents a significant turning point for local health services, marking the biggest real-term increase after nearly a decade, as my honourable friend has highlighted, of reduced spending between 2016 and 2024, and I hope that starts to put us back on track. We are pushing this commitment forward through engaging with a range of system partners and stakeholders to develop our new HIV action plan, which we will publish this year. And a number of points have been made about what should be included in that plan, and my honourable friend for West Lancashire will hear that, and will certainly work with colleagues here and in the department to make sure that that plan is effective. I'd like to extend my sincerest thanks to Professor Kevin Fenton, the Government's Chief Advisor on HIV, who's hosting engagement sessions and roundtables in parallel with external stakeholders, including the voluntary and community sector, professional bodies, local partners and others. We're also working alongside the UK Health Security Agency, NHS England and a broad range of system partners to inform the development of the new action plan and guarantee that it is robust, inclusive and evidence-based. This collaboration is essential because we're not just fighting HIV, we are fighting the barriers that keep people from knowing their status. We're fighting stigma, misinformation and inequality in access to treatment and care. So achieving these goals requires action, because the future is not just something we wait for, it's something we create. And that's why in December last year the Prime Minister committed to extending the highly successful Emergency Department HIV opt-out testing scheme backed by an additional £27 million, as the honourable member who led this debate noted. During the last 34 months, over 2.5 million HIV tests have been conducted through the scheme, indicatively finding over 1,000 people undiagnosed or not in care. These aren't just numbers, they're people we might never have reached, now empowered with access to critical sexual health services. Increasing testing across all communities is a cornerstone of our new action plan and essential to ending HIV transmissions. That is why we must harness the power of HIV Testing Week. Before I wrap up, Dr. Alan Cannon, can I just pay tribute, as the leader of the member opposite did, to my friend, the Sitting Bull in Sheppey, for his own experience, but actually using his experience to serve others and to help others, to motivate his own career in nursing. I think that's very powerful. And now his new career, and he's done that excellently today. Today, testing is not just about detection, it's about connection. It's about linking people to the care, support and community they need to thrive. It's about making sure no one is left behind, and that includes globally. We have committed to supporting the international effort to ending HIV and AIDS with £37 million, which will go towards increasing access to vital sexual and reproductive health services, including to HIV testing, prevention and management services for vulnerable and marginalised people across the globe. Our commitment is unwavering and our mission is clear. So this National HIV Testing Week, let me be clear, a single test can save a life, so let's make testing the norm, the expectation and the action that drives us to a future with no new HIV transmissions.
David Mundell to wind up.
Thank you, Madam Deputy Speaker, and I do apologise for the length of my constituency's name, because otherwise we could have had a longer debate. I think it's been a very good debate, and there's been some very powerful contributions, and I too commend the honourable members for Sittingbourne and Sheppey and West Ham and Beckton on the, reflecting on their personal experience. It's so important that we do that, and I think think both gentlemen show that you can move on from being someone who's HIV positive. You play a full part in the world, full part in Parliament. I particularly want to refer to 2 points which the honourable ladies from Clapham and Brixton Hill and Vauxhall and Camberwell Hill referenced, and that is, this isn't just about gay men. There's a stereotype that this is all about gay men and gay men testing. It's not. As we've heard, the statistics show gay men are among the most prolific having tests. It's about other communities. It's about women. That's the message we've got to get over, and that's why opt-out testing is so important. The honourable member from Cardiff West raised my pet subject, and that is the issue of PrEP. It is absolutely ridiculous, Dr. Ali Khan, that during the course of this debate, I could have emailed somebody in India and obtained PrEP. I couldn't go up Victoria Street into a pharmacy and do that. So as well as making sure that we continue with the testing initiative, let's make PrEP more readily available.
We're bang on time. It's just order. That's all I've got. Thanks.
Yeah, we get the book.
Yeah, read it.